I like to start these things off by letting you know kind of what to expect. So I did this presentation for a group of franchisees, about 100 or so folks a couple of weeks ago, and it took about a half an hour or so to go through. We kind of had questions all along, so it might not be quite as long, but there were some things that I kind of skipped and didn't go into because of the time constraint that I had, so I might expound just a little bit more, but that's about, so 20 to 30 minutes to do this. When we get through, I expect that you're going to be able to have a really good handle. What we're going to talk about is the what the government expects of you and who they expect it from. So we'll go through the penalties. We'll go through what size are you that you have to start paying attention when the government starts demanding things, saying that you've got to start providing coverage. So we're going to go through that. I'm imagining that many of you already know a lot, or at least some of the things that I'm going to go through. As I've had these conversations with operators really over since the early part of December, it's interesting what folks do and do not know. I didn't know there were two sets of penalties I could be subject to, those kinds of things. And so again, we're gonna do a brief kind of real big overview and then take questions at the end. But again, my hope is that this will be real applicable to you, and you'll have a better handle on what's required, what the government's requiring of all of us going forward. So first thing, we'll flip down to the first page, and already I have a glitch. So how do I get down? Page right, here we go. First page. So first of all, let's talk about what's required. Well, the government requires you to offer coverage to employees as long as you get to be a certain size, and so that size is 50 or more. And so the vernacular that the government uses is an ALE, an applicable large employer. So if you're over 50, then you're an applicable large employer. Now, what does that mean to be over 50? Well, you have to count not only full-time employees, and as you can see on the slide, that's indicated as those that work 30 hours or more, but you also have to account all your part-time employees. And the part-time employees, when you do the calculations, will tell you how many full-time equivalent employees you have. So you count not only your full-time but your part-time. So a full-time equivalent, if I had 2 employees that were working each 15 hours a week, then that would be 30 hours. That would be 1 full-time equivalent. And there's a calculation that you have to go in through that. And so so that we have to count full-time employees, we have to count full-time equivalents. Can I exclude anybody? Well, as the slide indicates, yes, you can exclude seasonal employees, those who work 120 days or less. So for those of you that may have employees that work just a certain season, three months or so out of the year, those employees don't count when you're taking a look at, am I an applicable large employee? So first thing is, then is you got to hit a certain number. Then the next question is, well, when do I count that? How do I count that 50? Over what time periods do I use? And there, the government gives you, the agencies have come out and said you've got some leeway with that. And so there's really, as it pertains to that, there's three terms that you have to understand. One is called a measurement period. Then you have an administration period, and then you have a stability period. And so all of that to say, and it gets to be very complicated, but all it is, measurement period is a time period that you're looking back over to determine, am I applicable large employer? And then if I am, of course, then I've got to provide coverage to my employees or offer coverage. If I'm not, then, hey, great, I'm not applicable to these rules and offering coverage. So we'll go into that. And so again, I don't want to get into more weeds there other than to say it's a time period that you're looking back at. Now, you can choose that time period. Time periods can be monthly, quarterly, semi-annual, or annually. Most of the time, I think people are going to want to look at an annual time period only because you want to cover those time periods. Some people get really busy, maybe in the summer and spring, but not so much in the fall and the winter. And of course, when you mute those hours over that time period, you might have somebody who's working full time in those those busy season, but then it's really part time in the other time period, and that would make them not be a full-time employee, which you're required to offer coverage to. So I think most people are going to use a 12-month time period. You're going to look back And so really, for sake of what we're doing here today, we can get into the weeds more later on, but really for what we're doing today, you have to know that there's a time period that you take a look back over. You count up your full-time employees, you count up your all of your part-time employees, and then again, am I over 50 or am I under 50, excluding those that are 120 days or less. So with your full-time employees, this question came up with the folks we were doing the franchisee group, and he said, well, what if I have a 40-hour employee? Do I have to count the 30 plus the additional 10 that they worked over? And the answer is no. You count your full-time employees. Anybody who works 30 or more, they count as one. They're not going to be 1.5 or 1.25 or whatever. Anybody who works 30 hours or more, they're one, and those you put in one column. And then in the other column, you add up all of your part-time hours. And for the month, if you were doing it for the month, you'd add up your part-time hours. You would divide that by 120, and that would give you your number of full-time employees. So if I had 1,200 hours in that time period, divide that by 120, that would be 10 full-time equivalent employees that I would have. And so I'd add the 10 to whatever my full-time number was. And again, if I'm over 50, that means I'm an applicable large employer, and there's a lot of stuff I got to do. If I'm not an applicable large employer, if it's under that, then again, great, you don't have to worry about that. So that's how you do the calculations. So real quickly, if I'm doing it then for a year period of time, what number do I use? If I'm using 120 for a month, then how do I calculate for a year? And that gets a little bit more difficult, only because from everything I've investigated and gone through, I can't see any kind of guidance from the agencies that tell us how to do that. What I've done with folks is I've said, take that 120, multiply it by 12. If you're doing 12 months, then that's your divisor. That's what you would divide it against. I've seen other folks who've said, now do you do it on a month-by-month basis, and you just average it out, average those 12 months out. But again, that's the way I would deal with it over a 12-month time period rather than look at it on a month-by-month deal. The other thing to remember in this is that you must offer coverage to 95% of your eligible employees, or you pay a penalty. So now we're back to it. Are we an ALE or not? And so if we are an applicable large employer, then the government says there's two penalties that you can get from the government standpoint. Basically, they say if you offer nothing, if you're not offering any type of coverage at all, and you're an applicable large employer, then you have to offer, if you don't offer anything to your employees, then you're going to pay a $2,000 penalty, and we'll get into that into the next slide. But the agencies have also said if you're offering something to the employees, not really good insurance, it's not great insurance, it won't cover all the things that you would typically find out in the marketplace, then there's a penalty that you're subject to there. That's a $3,000 penalty, and that penalty is assessed only on employees who go out to the exchange and get subsidized coverage. So again, I'm not offering any coverage at all to 95% or more of my eligible employees, those that are full-time, then I would be paying a $2,000 penalty. If I'm offering them some type of coverage, it's not great, but it's some type of coverage, then I would be paying a penalty of $3,000. These are annual penalties, but only on those that went to the exchange and got subsidized coverage. So there are two penalties, and again, I've had a number of people kind of confused about that. The biggest penalty of all of those is that $2,000 penalty, and we'll get into that, and I'll get into why that's the big penalty. People have called it the sledgehammer penalty, the others the tack hammer penalty, and we'll go through some numbers, and I'll show you why that can be so big. Then the other thing on this slide, the bottom part of the slide says, also remember that not only do employers need to offer coverage if they're a certain size, but everybody in the United States, every citizen in the United States, outside of those that are incarcerated and Native Americans and some other exclusions, needs to be covered, whether they're covering themselves individually or getting coverage through work. They all got to be covered, or they pay a penalty. And that individual penalty is assessed at year end. It started out very small, and it's always either a flat rate or a percentage of pay. And so in 2014, the penalty was $95 per adult, up to a maximum of 3 times that, or 1% of your pay. In 2015, it went to, I think it was $285 and 2% of your pay. And this year, in 2016, the year that we're in, it's $695 or 2.5% of pay, and of course with the government it's going to be whichever is greater. So the greater of those, so you can know that your employees, your staff, at the very least, I can tell you, are going to have to pay a penalty at year end if they're uncovered at $695 per adult. Again, there's a maximum of 3 of those. So again, a big picture, employer has to provide coverage if you're a certain size. Employees have to, individuals have to have coverage or they pay a penalty. So now we go into it's called the 4980H penalty. That's the section of the tax code that deals with this. And this is what's commonly referred to as the A penalty. The A penalty is an annual penalty of $2,000 per full-time employee. So if I'm not offering to at least 95% of my full-time employees, then it's $2,000 times that number of those number of employees at year end. The nice thing is that you get to subtract from that penalty 30, the first 30 employees or whatever, 30 off of that number. So if you end up, and I've got some clients that are in this case, where they are an ALE, they're an applicable large employee because they have enough full-time employees and enough part-time employees to push them over that number. But anybody who has 30 or less that work full-time, that 30 hours a week consistently over the year, or then if I'm at 30 or less, then I don't pay a penalty because I get to subtract that. In 2015, the subtraction, because it was a transition year, they allowed people to subtract 80 from that penalty. So it was a big deal. I know a number of folks who had 50, 75, 80 employees that were full-time and they didn't offer coverage. Well, that penalty, the subtraction from the penalty covered them so that they didn't, in essence, didn't have a penalty. A couple other things to remember here people try to get by with. You have to aggregate commonly owned businesses. I had this question as early as yesterday. I talked to an operator, and the question was, well, of my restaurants, can I have some of those that are owned, or I'll set up a separate business for this other, for one of the restaurants. Well, that's fine, but if they're commonly owned, then you're going to have to aggregate those together. I had another one of my clients who wanted to do, early on he wanted to do something in the front of the house. I'll have a different company for the front of the house folks than for the back of the house. And again, those things, commonly owned stuff, all has to be aggregated together. The other thing to know about the penalty, and I've had people tell me this, you can't subtract anything else. So from the penalty, you can subtract the 30, but that's it. I had one operator who was telling me he provided management coverage, and so in his group he had 50 managers, and so he wanted to subtract 30 and he wanted to subtract 50 from those that he'd provide coverage to, and the answer is you cannot do that. The law doesn't allow you to do that. So you get the 30 and that's it. There's nothing else. So it can be a pretty big penalty, again, because even if I missed by one, because remember, you have to offer the coverage to 95% of your full-time employees. So if I miss and I'm offering coverage to 93% of them, and I've got 100 employees, and I can prove I've offered coverage to 93 of those, but not the 95, and that thing gets audited, they'll penalize you that you'd pay 100 for 100 employees minus the first 30, so at 70, you'd pay that $2,000 penalty, which is $140,000. The other thing to know about that penalty, the employer penalty, it is non-tax deductible. So you do not get to deduct that. It's an after-tax kind of a thing. Okay, so that's the subset A penalty. The B penalty, again, is the $3,000 penalty. It's more, those are annual figures again, so $2,000 is assessed, those are assessed on a monthly basis, so that's $167 a month. The $3,000 penalty is assessed on a monthly basis, so that'd be $250 a month. But again, that $3,000 penalty only applies when you're providing some type of coverage to your full-time employees. Again, it doesn't have to be the best, but some kind of coverage. And any of those employees that go out and get subsidized coverage on the exchange, once they find out about it, then you're assessed the penalty for that individual. And the reason, again, that's a much smaller deal is we're just not having that many people going out and getting subsidized coverage on the exchange. They just aren't. In Oregon, it's right around 2% of the population. It's actually less than 2% of the population that goes out and gets subsidized coverage. So again, that tends to be a much smaller item for folks. Okay, so we've talked about ALEs, what size you have to be an ALE, and so the safe zone. What's the safe zone here? And so I tell all employers, hey, don't be an ALE, right? Don't be an applicable large employer. So have less than 50 between your full-time equivalents and your full-time employees be less than 50, right? But some people will tell me, and they'll say, Garth, I can't run my business that way, right? I just can't. I can't do that. It's going to require me to have more people. I have to be an applicable large employer. So then the next safest place to be is, if you have to be an ALE, then fine, keep your full-time employees at 30 or less, 30 hours or less. So, and a number of people have employed that strategy. They've said, yep, we're just gonna make our employees who were at 35, we're gonna drop them to 29 or whatever and get us down below that 30 number or right around that 30 number so that we don't have much of a penalty. That's the safe place to be. Okay, so now let's talk. I wanted to go through this example of this was a real example of a group that we have. 95. This group has about 200 employees. Of those, 95 are full-time employees. And so we go through the options. So what are the options? Well, the first option is, well, I can offer coverage, right? Do what the law says and offer really good coverage that's affordable, which would get me out of both the A and the B penalty. And so this employer can do that. They can offer that coverage. And so if they offer it, that's going to cost something. And so I put in here just a figure of $300. The cost can run any $300, $500. It can be anywhere around there. But let's suppose that in this case we can get coverage for these folks at $300. Again, offering coverage. Now I've listed here only 60 instead of 95 people. And why did I do that? Well, you can exclude employees who've got coverage elsewhere. So in this case, I assumed out of 95 employees, we got about 15 or so that get coverage elsewhere. So now we're down to about 80 or so employees. And then when I offer coverage, I have to pay for at least, I have to have at least 75% of my group come on that are eligible. In other words, if they don't offer any, if they don't have coverage anywhere else through their spouse or through their parents, then they would need to come on the plan. And why do they need to come on the plan? At least 75% of them need to come on the plan because an insurance company, the insurance company that's offering this coverage at that $300 price, they say if you just offer it to these 95 employees and we pick up 10 employees out of that 95 that say, yep, I'll take it, then those 10 employees, from the insurance company's perspective, are typically going to be the most unhealthy 10 in the group, right? And so insurance, that's that adverse selection, which is the second one down, B, that's going to be a problem. So if you would really be then required to have at least 75% of those employees left coming on the plan, which again, we're excluding the folks who have who've got coverage maybe through their spouse or parents. So that brings it down, and then we take 75% of that number, and I came up with this 60. And so 60 times 300 on a monthly basis, when you calculate that out, that'd be $216,000. So that's option one, is what we'll offer coverage. We'll do everything that they say they're going to, that the government wants us to do to escape any penalties. And that's going to come with a price tag of $216,000. So that's a big bill, obviously. And so for this, but that is an option, right? The employer can come up with that or find that money someplace and come up with that amount and then pay that amount. The nice thing is it is tax deductible, but again, it does provide coverage to the employees. But again, it's a pretty big bill. So the second option for the employers that we've got listed here is pay the penalty, right? I can pay the penalty. So what's the penalty? The penalty is 95 employees minus 30 in 2016 and on 30, so that's 65 employees. So then there's my other option, is I can pay instead of the $216,000, I can pay this $130,000 in penalties. And I've had employers that have called me and said, well, we feel we're just resigned to pay the penalty. We can't do option number one because it's too cost prohibitive. So we can do that. Again, the downside to the penalty is, it's a strategy employers can use, but the downside of the penalty is, again, it's non-deductible. So $130,000, you really have to make more, right, to cover the taxes in that. So it's non-deductible thing. And then the other thing that I've heard from employers is, gosh, it's something that I pay to the government. It doesn't even go to my employees. They don't get any benefit from this. Any direct benefit. So it's a downside in both situations. That's not a really appealing thing to do. And so what we have with the Restaurant Lodging Association is the third option for these folks. And so what's that? That's a minimum essential coverage plan. Remember when I went back to the government penalizes you if they'll penalize you if you don't offer anything, and then there's that B penalty. That you'd be subject to that B penalty here with the minimum essential coverage plan, because it doesn't cover anything. It only covers preventive care. Now the cost is low, and that's great. The cost is down, but it only covers preventive care. So the government says, well, look, you are providing something. It's not as good as we would want you to provide. Therefore, you're subject to that B penalty. So anybody that has this minimum essential coverage plan, again, with the cost, that's there again, $50 to $70 on the MEC plan. That's an option for folks. And so under benefits down below, then I list that. The first thing is so now for that employer who'd either pay $216,000 to make sure their employees had coverage on a good plan, a good, nice, solid plan that pays for everything, right? Doctor's bill, hospital bills, all that kind of stuff. But it's 216 grand, or I pay the penalty of 130,000, which is non-deductible. Well, in this case, I can put my employees on the on the MEC plan, and the cost there is 57,000. The nice thing is with this plan, the MEC plan, it does provide employees some benefit. First, it's the cheapest thing to do. It is tax deductible, so that's a tax deductible expense. It gets the employer out of the big penalty, the A penalty, and it does get those employees out of their individual penalty. So those individual penalties that you have at year end, again, that I talked about, that 695 or 2.5%. If the employees are covered under a MEC plan, they get covered under. It gets you out of both penalties, which is a nice thing. The downside is that you're still subject to the B penalty, right? That $3,000 penalty. But again, when I take a look and I talk over that with employers, there's a lot of room between 57,000, and I could afford in this size group, in this 95 person group, I'm estimating on the high end that they might have 4 or 5 people that would get subsidized coverage. And so if you figure paying the penalty on that and the 57,000 that they pay here, they're still much better off than doing than the other options. So we're coming up to the end of this. So remember, the penalties started accruing January 1. Really, penalties started back January 1 of 15, but for a lot of folks, those folks that fall in that 80 category, they were able to subtract 80. That got a lot of people out of that. So that was So in 2015, there was a lot of people saved by those transition rules that you don't have in 2016. Another thing that I'll share is I've had employers say, well, look, I'm just going to wait this out. I'm just going to wait this out and just see what's going to, what may change. We have an election coming up. The country, more than half of the country still doesn't like the Affordable Care Act. Maybe if there's a change in the White House, there will be some movement. And that absolutely could possibly be this. The Affordable Care Act has done nothing but change since it was implemented, since it was signed back in March of 2010. But certainly for 2016, nothing's going to happen. And so again, I think we have to look at this at a year-by-year kind of a situation and strategize and just figure out, what you want to do. 2017 may change, but man, for this year, it kind of is set. So again, the safe place to be, the safe deal is if you're not an ALE, hey, don't worry about things. And if you got nothing else out of this and you found out you're not an applicable large, or you can go back and do the calculations and determine that, and you're not an applicable large employer, that's great. Now you know you're not, and you don't have to worry about it. If you are an ALE, and I would say if you have over 30 employees, 30 to 35 full-time employees, I don't know that I would worry, personally, I don't know that I'd worry too much about it. Does that mean I'm going to pay some kind of a penalty? Yeah, you're going to pay some kind of a penalty, right? Over 30, anything over 30, so you might pay a $2,000 penalty on 5 people, which is 10 grand and isn't fun. But would I go to the MEC plan? Is that an option? And the MEC plan is an option. It's a good option for folks. It gets you out of those penalties. But I tell employers, look, if you're around 30, if you go up to 30, 32, you pay a penalty maybe on 2 people, then I don't know that I would be too worried about it, as long as you can hang right around 30. But if you're at a place where I'm at 35 or more, now that ALE becomes a very, very cost-effective, or excuse me, that MEC plan becomes a very, very cost-effective way to get your employees some coverage, so again, they don't face that penalty at year end, and you don't face that $2,000, that big penalty. So that's where that is. I have people calling me, just a side note, I have people calling me and asking, well, should I terminate my plan? I had a guy call 2 days ago, and he said, I've got I'm providing Kaiser coverage to my employees. Employees don't like it because what I could afford to give them was a very high deductible. It was like $6,000 or something. It's a very high deductible, so employees don't really feel like they have insurance. But it is good insurance, right? It's providing for medical, it's providing for surgeries, for hospitalization. God forbid there's cancer, those kind of things. It's going to provide for that, so it's a good plan. And he's saying, should I go to a MEC? Should I drop that and go to the MEC plan? And my answer was no. As long as you can afford to do what you're doing, you're in the best possible place. You don't have to worry about either the A or B penalty. It's at a time when you would say, gosh, Garth, I can't do anything else. I just cannot afford to do this. Now that's a time to take a look at the MEC plans and see if that might be an option for you. So giving you that, the last slide gives my information. And so there, anytime you have questions or anything, you can certainly call or email. And I know there's ways to get to us through the Restaurant Lodging Association website as well. So with that, I think I would leave it there and open it up for questions. So Lori, if you want to unmute, I don't see where I've gotten any questions come up in the written side.
Yes, so everybody is unmuted right now. If you have a question, go ahead and ask it or type into the question box. We may not have any questions.
Okay. So while people are thinking about it, did you guys know this stuff? Did everybody fully understand this, or was there new information in what I shared today?
I think attendees also need to unmute themselves if they've muted their phones. So I will be sending out an email tomorrow just to follow up with a link to the presentation to everybody that attended today. And feel free to respond to that if you do think of a question between now and then, or just call Garth directly with this information on the slide. You can also go to OregonRLA.org/health plan for more detailed information on the options there. And I think we'll wrap up since there's no questions. Thank you, everybody, for attending. And thank you, Garth.
Yes, you bet. Thank you, guys. Yeah, again, any questions or anything you have, feel free to give me a call. There's a lot of information out there. So if you have any questions on this stuff, let me know.
Great.
Okay, thank you.